Yasin with PCN has had a long-standing working relationship with HPFT. We've developed novel ideas of collaboration to try and improve the mental health access to our patients. What was evident is that over the COVID pandemic, there was a surge in mental health issues due to the cost of living crisis, loneliness and access to face-to-face clinicians. We've been working on a monthly MDT with a consultant psychiatrist, Dr. Coley at HPFT, working alongside the Enhanced Primary Care Mental Health Service and Hertfordshire Mind Network. On the meetings, we adopt the PARAS system that HPFT uses alongside the EMIS system in primary care and try and make correct clinical decisions on patients that would otherwise normally be referred to the SPA system. By doing this, we can help manage risk, initiate medications and titrate medications that we wouldn't normally be able to do. And with the benefit of our primary care mental health nurse, Eugenie, we've been able to go from strength to strength on this collaboration. We have high hopes to improve the service and would like to nominate it for the Integration and Collaboration Award.
Hello, my name is Liz West and I'm really pleased to be nominating our social prescribing team for Stork Valley and Villages Primary Care Network alongside our PPGs in the Excellence in Innovation and Collaboration. They have come up with the most amazing thing called Let's Talk. We've done Let's Talk Menopause, we've done Let's Talk Boobs, we've talked Let's Talk Digital Access, and we are doing lots of other things, and we've got themes coming up monthly in order to get messages out where a group of people can hear the same message rather than going to their GP and getting it on an individual basis, and spreading the word. For example, at Let's Talk Boobs, we took over a shop in Jackson Square, which is our local shopping centre, and spoke to over 3,000 people about checking their boobs. We managed to do over 150 blood pressures, and we also managed to persuade at least 42 ladies to have an inopportune smear test so that we could get those figures up as well. So it's all about collaborating, getting our patients on board, getting our PPG groups on board, and this is all driven by our most excellent social prescribing team. So I really wish them the best of luck and hope that they do become the leaders in excellence in collaboration and win this award.
This is a collaborative project around early cancer prevention for aligned to health inequalities, particularly around how to reach groups. Our system partners included the Hertfordshire Borough Council, Communities First, Hertfordshire Primary Care Network and Potters Bar Primary Care Network, alongside the GP Federation. There was also wider system partners including Cancer Alliance and Macmillan Service. Our key project goals were around increasing uptake in non-responders of cervical screening, breast screening and bowel screening. For the cervical screening, this was particularly in the groups who had not responded to traditional GP methods of contact. We also added a group around prostate cancer in the over 45 black males who we know are at high risk of prostate cancer and aggressive cancer. We also did some health awareness days, and we also launched and was a part of a Hertfordshire Against Cancer campaign. I'm delighted to say that we had over 1,400 so far since the project started, bookings of cervical screens. We have a conversion rate from calls to booking of 44% and a conversion rate for prostate cancer of 70%. These are just some key statistics. There's other statistics around obviously the other cancer areas. To put that in context, about 1 in 20 cervical screens do lead to further show abnormals and lead to further investigations. That would equate to about 70% of patients potentially who we've identified who would not have otherwise been identified without the project, who've gone on to further investigations and referrals. The project is ongoing, and we're looking to bolt on other facets to increase capacity around some early cancer cervical screening and wider system partners. But I'm delighted to put forward this nomination, and just some key points is really around embedding care coordinators within general practices. Many of these care coordinators have been part of our service delivery around Hertfordshire from the COVID project, with ongoing continuity of relationship, integrating them into the calls, into personal relationships, into contact with patients, with many case studies where that has made a significant difference with that personal touch and the ability to be able to book direct into appointments. as part of that service project focus. Thank you.
Hi, my name is Raj Mapara. I'm a GP at the Fernville Surgery in Hemel Hempstead, and I've been there for the last 34 years. I nominated the Nexus Health First Contact Physiotherapy Services for the award of integration and collaboration within primary care. My reason was as follows. They were instrumental in making sure that we could recruit physiotherapists and placing them in each of the practices within decorum, working with our local federation. There was a clear induction process, and they came and saw each of the practices, giving us a clear pathway of the kind of patients which would benefit from the services, thus allowing patients to be booked directly with them and helping with the capacity and GP demand. They collaborated well with practices. A good example of that would be when the Coda Equina pathway came out. They visited each practices and warned us on the safety aspects of patients waiting to be assessed for back pain and the message we can give to them directly. They also have a robust clinical governance process where quality control is assured by the senior physiotherapist observing the others, as well as a good educational program on a monthly basis where local GPs are also invited to come and give a talk and a presentation on topics relevant to primary care. Overall, the service has made a huge impact and in the management of musculoskeletal problems in primary care, where we can put patients directly with the first contact physio, thus reducing the burden on secondary care as well as on GP appointments. It is a well-oiled, well-worked system which has been integrated in a lot of the practices within decorum and is working very well. Thank you.
Hi, my name is Navina Sullivan and I'm the lead for Population Health Management and Health Inequalities at LVHPCN. We hold monthly meetings assessing complex needs patients, and the attendance includes a diverse multidisciplinary team, including practice leads, community diabetic nurse, social prescriber, health and wellbeing coach, and the Broxbourne Council rep. We also look at poorly controlled diabetics, looking at the household, the budget, and who cooks the food. We discuss complex cases with a joint interventional approach. We keep a rolling template to evaluate the service. Thank you.
Hi, I'm Dr. Neela Sassar. I'm the GP partner at High Street Surgery and clinical director for LVHPCN. I do chair mental health MDT meetings where we discuss 4 cases from each practice in front of GP leads, mental health liaison consultants, Holy Lodge consultants, CGL, police and ours for the educational purposes. These cases were discussed in depth and with a holistic approach. I must say the outcome and the turnaround is very quick and great. Thanks.